Hello, everyone. I hope you guys are doing well. Today, I will be presenting on health disparities in the elderly community. So before we begin, I'll start with a brief introduction. My name is Rachel Lee, and I'm a rising junior at Chantilly High School, located in Northern Virginia. Some of my extracurriculars include various school clubs and organizations, playing the violin in the American Youth Philharmonic, and serving as an executive for SCP and Connect Study. My career interests include majoring in the biological sciences on the pre-med track. So our first topic today will be health disparities. The CDC defines the term as preventable differences in the burden of disease, injury, violence, or opportunities to achieve optimal health that are experienced by socially disadvantaged populations, and they're affected by race, ethnicity, gender, income, education, sexual orientation, and more. It directly results in inequity in the quality of healthcare and is determined by the social determinants of health, which are unfairly driven by social and economic inequities. The main factors affecting the elderly community are age, socioeconomic, gender, and location. To break down each factor, we'll start with the most major one, which is age. The elderly community makes up 9% of the global population, according to 2019 reports. With greater age comes limitations in physical, mental, and sensory ability. Consequently, the elderly have greater needs, but they're facing disadvantages in accessing appropriate, affordable, and quality care. Senior citizens also experience isolation from friends and family, especially when placed in nursing facilities, which puts a strain on their mental health, leading to depression. The lack of proper laws and policies or enforcement that provide health equity and rights to health and security is probably one of the leading causes of health disparities. As you can see in this graphic, the highest rates of depression are reported from nursing homes. Socioeconomic disparities are also a large factor in health disparities as well. They are influenced by race and ethnicity, income, social class, occupational background, education, and sexual orientation. And it is the expensive rates for quality health care that puts a financial burden on thousands of families annually. Race continues to impact treatment as African American elders receive substandard care and treatment and have higher mortality rates. There is also a significant gap between the quality of healthcare offered to whites in comparison to minorities. Pensions and retirement plans also factor in, as the elderly find that they cannot afford health services, therefore moving into nursing homes and long-term care facilities. However, these facilities are accompanied by several dangers, especially evident during the COVID-19 pandemic. Nursing facilities have seen some of the largest outbreaks of COVID-19 infections and have had devastating mortality rates. There have been higher death rates for people of color within facilities who are dual enrolled in Medicare and Medicaid, and severe neglect has also been observed within these homes. More than 184,000 resident and staff of nursing homes and other long-term care facilities have passed away from COVID-19 alone, and this number only continues to grow. Geographic location also impacts the quality of healthcare as well. When comparing a rural versus urban setting, rural residents are less likely to be insured than their urban counterparts and have been demonstrated to be in poor health. Rural minorities are further disadvantaged in cancer screening and management, cardiovascular disease, and diabetes, which claims the lives of the majority of the elderly community. Distance has also proved to play a role, as underserved populations are located at a greater physical distance from healthcare services. Some nursing homes located in densely populated areas have also found themselves with little to no resources. I provided a world comparison for a bigger picture, and I've compared healthcare in the US to that in sub-Saharan Africa, which many of you will already be aware is home to the poorest healthcare system in the world. While the US has government-funded healthcare programs to help support minorities such as Medicare, low-cost and free clinics, and efficient health services, few countries in Africa are able to spend the $34 to $40 a year per person that the World Health Organization considers the minimum for basic healthcare, according to the World Bank. 50% of health expenditure is financed by out-of-pocket payments from individuals, and an estimated $25 to $30 billion in new investment will be needed to meet Africa's healthcare demand, especially to support senior citizens. There is also an unbalanced gender ratio, as there are higher mortality rates for females. Looking into nursing homes across the USA. Nursing homes provide a wide range of health and personal care services, but they have a more narrow focus on medical care. Most residents have ongoing physical or mental conditions that require constant care and supervision. However, it's been observed that caregivers are engaging in unethical behavior, such as the use of unauthorized drugs to tranquilize patients and verbal abuse. There's also been a toxic environment as staff are insufficiently trained and there's a lack of government funding and attention. Furthermore, these facilities are subject to poor management. Out of thousands of nursing homes across the US, Bethel Lutheran homes are infamous for being one of the worst in the country. They have been charged with seclusion, manhandling, and verbal abuse to their elderly residents. They receive little to no funding and no supervision and have never been inspected. However, Marlborough Health and Rehab Center is voted one of the best in the nation for their dedicated and compassionate staff. This facility receives abundant government funding and intervention, strict enforcement, and undergo monthly inspections. It's evident that proper management, rules, and regulations can positively impact long-term facilities. What we can do to improve the situation. We need to push for more government intervention as it will set up a sort of domino effect. With intervention will hopefully come stricter consequences and proper laws and policies, which will then support funding, seasonal inspections, better training and education for staff, and solutions that will address health disparities. As Anne Frank said, at an age not too different from us, how wonderful is it that nobody need wait a single moment before starting to improve the world. Anyone and everyone can start to take action, and as more people put in their efforts, there will be a difference. I want to re-emphasize that health disparities are preventable, and while proposed solutions to alleviate the consequences of healthcare inequity and the disparities between the quality of care of different individuals have never been explicitly directed towards the elderly community, they should be our priority. I want to take the time to acknowledge all the authors that helped me throughout my research, and thank you all for joining in and listening to my presentation. Also, a huge thank you to the Global Health Leaders Conference staff for providing this platform and the opportunity for me to present. If you guys have any questions, comments, or concerns, feel free to email, and thank you all for listening to this presentation.